dear and experienced moms as well as moms-to-be. Welcome to another exciting and educational episode of Mama's Nest. I'm Fome Ejumudo, your host for the show. Mama's Nest is proudly powered by Cousins Baby, makers of child skincare products to support moms on their motherhood journey. Mom, you can do this. Welcome back to Mama's Nest. And today on the show, we're discussing newborn care. I always say that after you have your baby and they give you that little human to take home, there is no manual. There's nothing at all. What are you going to do with that little human? Today, we're looking into all of that. And joining me to discuss that is Mary Akinbobola. She's a mom to a beautiful 2-year-old girl. Thank you so much for joining us.
Thank you for having me.
Oh, it's good to have you here. We also have Nurse Fumilayo Akiriade.
Thank you for
registered nurse. Yeah. Thank you for joining us.
Thank you for having me here.
Thank you so much. So, ladies, those little humans, the work that they come with, they don't do much. They won't talk. Just give them food. They sleep a lot. But the work that they come with, like it's so much. It's so much. And there's this thing that they usually say that if your baby is hiccuping, you put a white thread on the big head. Does that really work? Did it ever work for you, Mary?
No, but I did it.
You did it anyway.
Yeah, I did.
You did it anyway.
Everybody do that, so I went along with the trend.
It's a common
thing.
Does it work? Seriously?
No, it doesn't work.
I think if you believe it, it works.
Yeah, if you believe it works. But the best thing is to put the baby to breast.
Yes.
It will stop.
Since you can't give water.
Since you can't give water
at that
newborn
phase, you can't give water. So why is it that babies stay awake? The whole world is sleeping. Everybody is sleeping, but it's when you need them to sleep that they are awake. That time they want to play. Why? Are they trying to adjust to a new environment? Are they trying to, I don't know, or is it because they sleep all day and I don't know, why do they stay up all night?
Yeah, they are trying to adjust to the new environment. You know where they are coming from? The place is warm, cool. You can't imagine the place, you know? All of us came from that place. So they are trying to adjust. So you see that a baby, during the day, they will sleep. In the night, all day, in the night, they will be awake. They will not allow the mother to sleep. They will be crying, and eating. So the best thing is that when the baby is sleeping during the afternoon, as a new mom, you need to sleep as well. You just have to.
I'm happy you said that.
Follow the trend.
Does that really?
You just have to, because taking care of baby is not an easy task.
Because when they are sleeping, you're trying to catch up on other duties. The chores, especially if you don't have as much help. The chores, you need to make food, you need to take care of yourself, probably take a bath, I know they do say rest when the baby's resting, but was that realistic for you?
We do encourage
that.
Yeah,
it was. So what I did was I had to switch network. Let me use the word.
So
I work with her time. Good. So I sleep when she's sleeping. Yeah. And if she's awake, maybe in the night, that's when I do my house chores. House chores can actually wait. There's no specific time to do your house chore. You can do it in the middle of the night. So what I do is, when she's awake, that's when I work. And when she's asleep, I'm also sleeping. So I work with that time. If she's doing Canadian time, I go with it. If it's New York time, I go with it. Whatever time is it that she decides to sleep, that's what I go with. If not, you just be too stressed.
You'll be too stressed. Wow. Because I remember when I had my baby, it was hard for me even to sometimes you don't even have time to take a bath. Sometimes you don't have time to take care of yourself. You're in your pajamas all day. But I think it's really smart what you did, that you were able to discipline yourself.
That's what I said. She's crying. And you're out of the bedroom and she's not crying, she's sleeping. And
or sometimes you're having your bath and then the baby starts crying and then you jump out. Oh, is my baby okay? It's really hectic.
Yeah.
Nurse Faith, can you tell us when the umbilical cord is supposed to fall off?
Okay.
And if there are any delays, what can we do about it as well?
Okay. Concerning the umbilical cord, we have the range 10 to 12 days. But some cord fell off maybe 7 days before.
Okay.
But it can extend to maybe 7 days to 21 days, there is no cause for alarm.
Okay.
It will definitely follow. You keep on cleaning the cord with cotton and spirit.
That cleaning.
Yeah. That's how you have to do it.
And you have to really do like a
you have
deep
to do
cleaning.
it, and the diaper must not cover it. You know, it must be the area must be dry, so that there will be no any infection.
And even while taking a bath, you must prevent water from touching
it. And immediately after the bath, you dry the water. That is why when you finish bathing the baby, you must clean the cord area.
How did you cope with cleaning? Was your mom around? Did she help with that?
My mother-in-law was around.
So she helped with that cleaning?
Yeah, but it took a while before the cord fell off.
So I remember we also had a very stubborn cord.
It took like 16, 17 days.
Okay.
All right. It's still within the normal range.
And she was like, your father's own fell off even before the
But it was hard for me to clean that.
The cry, I'm not always there because I don't like it when she cries.
Sorry, there's a saying at times that the person that called the cord, it has a lot to do with the,
Yes, I remember my husband was with me, so he
maybe their hand is too hard, so it will stay long, but it doesn't have anything to do with that though.
But it doesn't have anything to do with it. But that cleaning of my mom had to clean, but once in a while when I had to clean, it's a bit. I don't know how you nurses do it, but I'm not
afraid.
I'm not used to all the blood
That's
and all
how
those
the first time used to be.
Ooh.
As time goes on.
I don't know if you ever tried cleaning it, but
no, I'm not always there. No, I don't usually start because I don't like it when she cries.
It's not a very nice experience because it's not a light cleaning. You have to do like a deep cleaning to avoid infections and all of that. Wow. How about breastfeeding your newborn? It's also one of the things that we must do to ensure that our baby is well fed,
and to create bonding between mother and the mother and the baby.
The mother and the baby.
Strengthen the bonding.
And there's this thing they say about when you give birth, immediately you must hold your baby.
Yeah.
How does that help? It's part of the bonding process, I guess.
It's part of the bonding process.
So after you clean the baby,
as the baby comes out, you deliver the baby to the chest of the mother.
Not every time. They did not give me my last baby. They didn't give me my last baby. I don't think they did. But
maybe there is a reason for that.
They cleaned the baby first.
Before giving you.
Yes, before giving me the baby. It's such a beautiful experience. It's such a beautiful experience. But how about moms that give birth with CS? Are they also not able to hold their baby first?
No. They can't hold their
immediately
baby
after giving birth.
No, it's after maybe some hours.
After some hours.
After
a few hours.
So the effect of the anesthesia will wear off.
Okay. So at that same point where you are holding your baby, are you trying to breastfeed or not yet?
If the mother have the strength, normal delivery, I'm talking of.
She has recovered enough.
Yeah.
She can.
It's good to initiate breastfeeding immediately.
When I had my baby, my mom didn't come on time for the traditional omugwo. So I had to bathe my baby myself. She was so tiny. I was like, where am I going to hold? Like, where am I even going to start from? At that point, the neck is still very tender. She's so tiny. I was really confused. And then putting her in the tub, the tub is a little bit hard. Sometimes I had to go this way. Sometimes it will go this way. I'm like, am I even doing the right thing? I was so confused. Yeah. But did you ever face anything like that? And how did you cope with it?
Yeah, I think there was a time where my mother-in-law wasn't around. So I was left with her. I was looking at the baby. She was looking at me. I was like, where do I want to start from? But luckily, I remember that when I was going for my hospital shopping, I got like a baby bath clip that can be clipped to the bowl.
Like cloth?
So it's like a cushion to hold the baby in the bowl. So I just placed that in it and I tried. But even at that, it was kind of difficult because it was as if she was wriggling out. It was so small. Then to even carry her out, I had to come. My husband, babe, come, let's do this thing together.
Your husband didn't help?
He did not help. It was like, how do we carry her out of this? I was like, just make sure that we wrap her. So we had to wrap her with the clothes while she was still there, then place her on the bed.
It's usually more comfortable holding them and, breastfeeding. But that bathing aspect
is always very, very difficult.
I think we need your help on that one.
Okay. So, I want to get the baby?
Oh, please get the baby.
Yeah.
First, just quickly show us how to actually hold the baby. Okay, I can see you're already holding the baby.
This is how to hold the baby. Your upper arm, you see?
Yes.
That's your upper. So this one.
Okay.
That's how you hold the baby.
Okay. So I think later on you give us a demonstration on how to actually bath the baby.
How you doing?
And I do understand also that as a newborn, you need to swaddle your baby. They say that it gives a feeling of when the baby is still in tummy, but let's be realistic. Our climate is a very, very hot climate. Yeah. They often tell you when these older women see you outside with the baby, just remove only the cap, cover the baby's head, cover the baby's leg. But how much covering? Because I noticed even when I cover so much, the baby sweats and becomes uncomfortable. How much covering is actually needed?
Baby did not really need much covering. You know, the baby, there is a cotton cloth is good for the baby. So when you wear the cotton cloth, the one that have button up down,
the bodysuit,
the bodysuit or jumpsuit, that one is enough. Put on the cap, wrap the baby. The baby must not go through excessive heat.
An excessive cold.
So it's in between.
So I'm also thinking that when you notice that the baby starts sweating, remove the cap.
Remove the cap.
It's not compulsory the cap should be there.
Even when you remove the cap, they always like, where they cover the baby's head.
They will say the front and have no clothes.
There's no window there now. It's okay for you
the baby is also a human being. So just treat the baby like a human being. And when you're feeling it, you don't go through.
I'm sure after a few days, they also adjust to the weather conditions.
They adjust to the weather condition as they grow.
Yes. Wow. So thank you, ladies. We'll take a quick break and we'll be back shortly. We're back. It's still Mama's Nest. And before the break, we were having a very interesting discussion about newborn care. What are the basic things that you need to do just to make sure that your baby is well taken care of? I still have Nurse Fumi with me here and Mary. We've been sharing experiences and Nurse Fumi has also been giving us her expert advice. So we need to go deeper. We need to go deeper, ladies. I'm sure we've not even scratched the surface yet of all that it actually entails to take care of a newborn baby. What are some of the sleeping positions that you would advise? You know, traditionally, they say lie the baby down on the tummy, the baby will sleep for longer and all that. But there's also another school of thought that claims, mostly in the abroad, that there's something called like a
supine position.
Yes. And
when the baby will lie on the back and the head will be turned to one side, seat to one side, to prevent any regurgitation or aspiration.
Okay, that's to prevent regurgitation
or aspiration.
Okay,
that can cause sudden death.
Oh, I see. So, would you recommend the baby lying on the tummy?
No. I will recommend lying on supine position.
On the back?
Yeah, with the head seat to one side. Alternatively, you can as well rotate to the other side. You can even make the baby to be on the lateral position, like you use something to support the back. So that the baby will not always lie on his or back every time.
Okay. Can you take our baby again and quickly show us these different positions that you're so we can understand just a practical demonstration. Thank you. So that will be
this is our baby.
Yes.
The baby can be like this, but in a such a way that you
see slightly tilted,
not
and then you support
with a pillow, and the head will be turned to
Yes. So the baby is not totally on one side.
It's not totally on one side.
Maybe like a 3/4 kind of. Okay, and not totally on the back as well.
Yeah.
Interesting. Thank you. And thank you, Nurse Fumi.
You're welcome.
And Mary, what positions did you prefer to lie your baby on?
She sleep well when she's on her tummy. Like she sleep as
you
long as 4 hours,
yes,
5 hours, 6 hours. So what I do is I also read about the SID kind of something. So what I usually do is I'm always there, observer. But if it's in the middle of the night when I know that's impossible, and especially because I usually breastfeed her while lying down, so I just use this position. But in the afternoon nap time, she's always on her tummy, and I'm making sure that I check her because I notice that she sleeps longer when she's on her tummy.
Okay. And Nurse Faye, there was something you also mentioned, which also brings me to the question of baby burping. They say it's always, after that thing is work. After you breastfeed, you will now start waiting for the burp. Waiting. Has the baby burped? Has the baby not burped? Until that baby burps, you can't put the baby down. Yes. Why is this burping so important?
Why is it important is that to prevent regurgitation. Aspiration. When baby aspirates, it can lead to sudden death. So you must ensure.
Sorry, what do you mean by aspirates?
Like, their food is not yet. If they don't pump them very well,
okay,
they may not. The food, sometimes they hide food in their cheeks.
Okay.
Yeah. Sorry, I want to quickly share my experience with
that. They hide food in their cheeks.
With my baby.
Okay.
After giving birth to her, they had to give her food. So I think she was not properly bobbed because she had bloated tummy.
Mm-hmm. Okay.
And even though the pediatrician was like, maybe it was something else, but myself and my husband were trying to link it up with maybe it was the formula she was giving immediately after birth that didn't work well. She had bloated tummy for like 3 days. I could not breastfeed. Wow. She was just going through IV fluid just so that the food could go down. She was in uncomfortable discomfort, because the tummy was so bloated and all that. So I think that is one of the reasons.
So it could actually cause all that?
Of course. So that is why after feeding the baby, you must ensure. And what to make it to be fast, put the baby on your shoulder and rub the back.
They usually take a lot of time to
you have to be patient.
Sometimes it takes so much time. And
you have to be patient. You are not doing it well. Excuse me.
Can we move on with our
because you are not doing it well. I used to.
So what's the right way to do it?
You have to be patient. You put the baby very well.
We have things to do.
It's because you are not impatient. That's why. It doesn't take much time like you feel.
So pat the baby on the back.
On the back. You hear it. Oh.
Sometimes it's very loud, but sometimes you can barely hear it sometimes. All right, now Spoonby, please show us quickly how to burp the baby properly.
Okay. So after the feeding, and you want to prop the baby, you put the baby on your shoulder. On your shoulder, making sure that the nose does not covered. So you now start rubbing the back gradually.
How about patting?
No.
Oh, not patting.
It's not patting.
It's not patting.
It's not
Maybe
patting.
That was a mistake.
I know.
Sometimes
it's not patting. You can see the way I'm doing it. Circular way.
After all these years.
so it's not like this.
Now.
No.
Okay.
Rubbing
gently.
Before you know it, the baby will burp. So after that,
it's always such a relief to hear that burp.
Even during the process, the baby might have slept on your shoulder.
Yes, they usually sleep off as well.
So you now go and you put the baby back. You wrap the baby.
Awesome. Thank you, Nurse Fumi. Also, this sudden infant death syndrome is something I've often heard of, but I've never really experienced. I've never heard anybody tell me the story. But have you ever had any experience? Have you had any patients who had any statistics, especially in this part of the world? You haven't had?
I haven't. I used to heard about it, but I've not.
You've not
experienced it.
One story I heard was
a
woman that left her baby on the bed with some cloth around the baby and was in the kitchen cooking. But by the time she was back to the room, the baby was gone.
Wow.
So when they got to the hospital and also they asked a lot of questions, and then they realized that it was the clothes that was around the baby, that the baby tried, maybe in the process of turning or something, pulled up and then covered the nose. And, you know, since the mother was not there to help, and also...
That's sad. And that's why it's often also advised that the area where your baby is must be clear. The cut must be clear of hard objects as well as clothes and anything at all that can endanger the baby's life.
All these fluffy
pillows,
all these fluffy teddies and
that they used to do decoration and all that. They look nice, but your baby doesn't need it at that particular age.
Yeah.
That's really sad, eh? They talk about it a lot abroad, but
it's not common here.
It's not very common.
It's not very
common. Clothes.
It's not very common.
But the story you heard, it was a Nigerian.
It was a Nigerian mother. It was clothes. You know, I think she used the clothes to guard the baby, so that the baby does not fall over the bed. But in the process of the baby turning, so the clothes
fell over the baby.
No, the clothes was used to cover hold the baby.
So
like the baby turned and then on the clothes.
On the clothes.
Yes,
so light.
Exactly on the clothes.
And it's really sad. You know, the funny thing about babies is that by the time they start turning, you won't know.
You won't know.
So many of us leave our babies on the bed, especially when we're around there, or just for the ease of easy access to the baby. And before the baby will start turning, you won't even realize. All of a sudden, you just notice, my baby has flipped though. I don't understand.
You even meet the baby.
I didn't drop you like this.
Now, my time, I used to sometimes I will now be looking for her.
But no, I didn't put you on the floor. Why are you on the floor? So, but since I heard that, I was on. It was always in the middle. I wasn't using clothes. Even when my mom wanted, I was like, no, let's not use clothes. Let's just place her in the middle. Before she now decides, she's still a newborn. Before she turn.
She will start turning before you know it. But the best place to keep your baby is the cot. Because the cot is very well guarded. Yes, and your baby is
not too spacious like
the bed.
Like the bed. Yes, like the bed.
Or queen size.
So they don't have all that space to flip and do all those stunts they do.
Yeah.
And what do you ladies feel about mothers sleeping close to your baby? Did you sleep with your baby?
We still sleep together.
I know that. I know this for a fact. That Nigerian mothers don't do.
But she's not using it.
Exactly. We had a cot. We barely used it.
We don't use it. Okay, you know, for easy access,
easy access.
Because of that, because I noticed that when she was on the cot, you know, for me to carry her to breastfeed, she'll wake up. And we're on it for another 2 hours. But when she's beside me, she sleeps off easily. And we'll continue our sleep.
Did you start that early on, like when she was really young?
Yes,
as early as possible.
Because I need my sleep. Why will I wake up to go and breastfeed?
It's true, but the downside to that is the fact that it's harder to wean your baby off your bed.
We are finding it difficult.
When
to go to our room now. We are
when it's time to go to her room,
go to your room.
You have to start retraining her to sleep on her own. In the middle of the night, she opened the door and then we are going to come back. But you're in your room now. She's going to come back. I dismissed my kids when they were like, 5? And they're even back now. So it makes it really, really difficult. And another downside to it, from my experience, is sometimes your baby might not go to sleep unless you are nursing her. Unless you are with her.
Unless there's even somebody in the room. Even now, she won't go to sleep unless there's somebody in the room.
Or unless you are with her. And sometimes in extreme cases, she has to nurse and then fall asleep.
Yes,
and
before leaving the room.
Yes, and it can get frustrating at times because you are busy doing something and somebody's tugging at you to nurse.
Because I want to sleep.
Because you want to sleep. And even sometimes when you get up, the child will wake up because...
Exactly.
Mommy, excuse me, where are you going? Where are you going? You can't leave me here all alone. So those are some of the downsides to it. Yeah. There are a few mothers that they train their baby, they put the baby in the cot. I know one of my aunties...
You need to do that with the second one because she has taught me
I pray you're successful because it takes a lot of discipline.
Yes.
The baby doesn't want to be in the cot. The baby obviously wants to be held.
Yes.
But you have to teach the child with repetition that, no, this is where you sleep.
They get used to it.
They get used to it if you don't give up. If you don't give up, they get used to it. But it's a lot of work, especially for mothers that have to wake up in the morning to go to work. It's a lot of, sometimes it means you will not sleep in the night.
Yes.
Because when the baby cries, you have to go back there.
You have to go back.
Probably nurse or rock her.
Or rock her.
And then put her back. She might wake up again.
So it's taxing.
It's really, really tasking. But I think it's eventually it's the best way to go.
It's the best way.
It's the best way to go. It might take a few weeks, but put in the work and you have a lifetime. I remember once I visited my cousin and her baby was all alone in her room. She woke up by herself. She was in her cot. She was playing and looking around. There was nobody in the room. She wasn't crying. I'm like, how did you do this? How on earth were you able to achieve this? But I think it's just the training that I think babies get used to what they know.
Yes.
They get used to
what you always present them with is what they know, is what they get used to.
For example, if you like carrying baby, as soon as they get used to it.
Is there any such thing like they get used to hand?
Yes. Anytime you drop them, they will start crying.
Backing.
No, you can't back her. She has to be on. Because I know that when you are gone, she'll be expecting me to continue backing her where they are at the time.
Hold on. Let's be honest. This is a newborn baby. They need to be held. They need to be cuddled.
Don't you know they learn?
But which one is get used to hand? So there's such a thing as she likes carrying. Yeah, she likes being carried.
They know that, okay, mommy will carry me. I have this one mate. So if they are carrying you all the time, and somebody now say, I'm not carrying you.
Again, how will you feel? They will start crying. So you have to go and carry them again, and they will stop.
Because I remember then when I would hold my and then I was trying to practice this, put the baby down, maybe in the rocker.
Yes.
And, just so that you have some free time. And then my husband would say, no, that this is a newborn baby. She obviously needs to be held. She needs to be held. She needs to feel the warmth of her mom.
I think one can do that for the first 3 months.
It's first 3 months, not too much time.
I'm thinking just so that you can feel that connection. But if you continue to do that over time, by the time they are 1 year old,
you can't continue.
It will be difficult because they want, even when you're in the toilet, when you're in the bedroom, when you're in the kitchen, even in the house, they will just be like
crying,
they'll be tied to your clothes, glued to you because they are used to that.
They're used to
mom is always around,
mom is always there.
So I think it's best that at a point
we should make them
3 months or so, let them start getting used to playing alone. My little girl can play alone with her toys for 1 hour without mommy being there.
Let them be self-sufficient too.
Self-sufficient.
It's important. It's important. I think it's training not just for that early newborn stage, but also like training for life. When they start school, they go to crèche. They might not cry as much and all of that. Thank you, Nurse Fumi, for that demonstration on how to hold your baby. A lot of people are scared to hold a newborn. So that was very useful. And thank you for watching. Please look forward to the next segment of the show. If you have any questions, please feel free to leave it as a comment or send it in to any one of our social media handles now scrolling on your screen. And don't forget also to download the Mama's Nest app for more engaging content. Thank you, and I'll see you in the next segment. Mom, you can do this.